Hi, I'm James. Welcome to Homegrown. This week we've teamed up with Monument Health to bring you an episode all about rural health care. It's been really amazing to see that one of the unique opportunities for some of the kids with disabilities out on our ranches is to connect with horses and actually get some therapy out of being with their animals and out on their ranches.
We have a son, Traylon. He's 15. He is a freshman this year at New Underwood High School.
Awesome.
And our daughter, Taya, is 12, and she's in 7th grade this year. 15 years ago, I was pregnant with Traylon. My water broke early, so we went into the Rapid City Hospital, and I was on bed rest. He was born premature. He was 3 pounds, 3 ounces.
Wow. That's little.
Yeah, he was tiny. He had chronic lung disease. He was in the hospital for 3 months. He came home on oxygen to help his lungs mature. He was on oxygen for a year. And yeah, he's pretty healthy now.
3 months he was in the hospital and you weren't. That had to be pretty tough.
We live 10 miles north of Union Center, which is about 75 miles from Rapid City, which is pretty far out.
Yeah, so 75 miles away?
Yeah, so I just would drive, and I was very thankful at the time that we had Rapid City here, because if we hadn't, I would have been in Sioux Falls with him or Denver, but we have that right here. Yeah. And so it made it possible for me to come home every night.
Yeah, I mean, that must have been a pretty tough adjustment as parents to, you know, it's just not the storybook that you think of when you start a family, right?
Right. It was nerve-wracking.
Yeah, I can't imagine.
I was nervous.
I remember bringing our first kid home when he was perfectly healthy, and I was nervous as all get out, you know, so. But yet, you said he's come through it well and has had a few difficulties since then, or?
Not really. When he was younger, he would be in the hospital once a year for respiratory issues, RSV, stuff like that. But, yeah, but other than that, he was good.
Pretty normal kid, and apparently Dad's got him out in the hayfield a lot, so it must not be too bad, right?
Nope, he gets along good.
What's your favorite part about being on a ranch?
Oh, just that I'm out here and I'm not like, if I was in town, I wouldn't like being in town just because I don't get to just go out whenever I want to, you know, and just do stuff that I want, you know.
Got a lot of room to roam here, don't you? Yep. How about you? What's your favorite part about being on a ranch?
I just like all the trees and all the pastures, how pretty it is.
You seem to get the nicest tractor on the place, and your dad even said, you're like, yeah, that's his tractor. He spent all summer in there. Did you really spend that much time in that tractor?
Oh yeah, I spent a lot of time. It's a lot, most of my days this summer in that.
What is it, and what were you doing?
Oh, I was rolling bales. Rolling bales and just raking hay and just whatever just needed to get done, you know.
Tell us about the tractor. What do you like about it? What is it?
Oh, it's a John Deere 7330, and it's one of the nicest ones we have, so that's nice. I get to drive that one.
What about you? Any equipment? You get to drive tractors or do anything fun like that? Ride horse? You got to round up all the cows and do all the dirty work, or what do you have to do?
Not much. I'm planning on getting a horse.
Yeah?
Trying.
Right on. Why do you want a horse so bad?
I just like riding horses in general.
A few years later, Taya comes along, and once again, some difficulties arise.
Right. She was born at a normal weight. Everything was fine when she was born. At 16 months old, she started getting sick. We weren't sure what we thought she had. It was just a virus is what we thought. And then she was diagnosed with type 1 diabetes. Wow. An autoimmune disease.
Right. So it's got to be kind of a blow, you know, to get that news again.
Right.
How did you guys deal with that? I mean,
just do what you have to do and just get through it. Do what you need to do for them.
Tell us a little bit about what you have to deal with on a day-to-day basis, as a lot of kids don't.
I have to, well, now I have a CGM, which tells me my blood sugar, but I usually had to prick my fingers every single day. I had to get needles.
So you have type 1 diabetes, is that right? And so you have to really monitor your blood sugar levels or things can go pretty bad pretty quickly, right?
Yes.
So does that limit your activities, or not really, or is it just something you have to learn to live with?
Nope, not at all.
Living with type 1 diabetes, it's an everyday battle.
Okay.
But she's responsible. She takes care of herself. I feel like she helps me now that she's older. She helps me take care of her as far as what she needs medically. In 2015, we were asked to be the Children's Miracle Network ambassadors for South Dakota. So
Wow.
we got to go on a couple trips. We went to Washington, D.C., met with John Thune.
Cool.
Got to hang out with kids from all around the United States representing their state. We went to Orlando. So we've just really tried to spread the message about CMN and how important it is to have that around our area, because you never know
Right.
when you might need it, and it's there when you do.
So how, if I can ask, I mean, how did they influence you guys through the process of when your kids were ill?
First of all, when Traylon was born, they had it's called a giraffe bed, but they're thousands of dollars. And without Children's Miracle Network, that would not have been possible, that piece of equipment. And essentially that's helped Traylon be here today with us.
Really? So they've really enhanced your lives, and then as ambassadors, you kind of have a chance to give back and help out the organization. Is that how that kind of works?
Spread the message,
Okay.
how important it is.
Cool.
Yeah.
I mean, let's just talk a little bit about Monument Health. I mean, you said, yeah, they're right here, but they're still 75 miles away. And so I think that's something that as technology progresses and, you know, as we get further into life, they're trying hard to enhance their rural access, right? And can you just talk a little bit about how you've experienced that and how they've helped you guys?
Well, they're always a phone call away when I need them
Yeah.
for Taya right now. I can upload her information and send it to them, and then they get back with me, and if we need to change something as far as her settings to manage her diabetes. So that's...
So you don't have to go in, you can just upload stuff a lot.
We do go
Right.
in every 3 months, but it's just, they're a phone call away, essentially.
Being by Union Center, they're probably not going to put up a hospital anytime soon in Union Center, but yet Monument's trying to do their part to reach out and help you guys, it seems like.
I feel like for us, Taya has one of the only pediatric endocrinologists in Western South Dakota.
Yeah,
And she's amazing, and we're lucky to have her
yeah, yeah,
and her team.
right. Yeah. So how old is Morgan?
She's 22.
22.
She was diagnosed at about a year. We started to notice her not meeting some of her milestones.
Yep.
Did an MRI, found out it was abnormal. And so she was probably officially diagnosed at about 18 months, and we started different therapies
Sure,
immediately.
right away.
And through the Birth to 3 program, and then through the school system until she aged out of the school system, and then
Right.
we went to Black Hills Special Services.
You know, I'm not familiar with many of those programs. How does Monument fit into that?
The neurologist that we initially saw was employed
Yeah.
by them. In addition to the therapy that she got through the school, I would take her to the Monument Health Spearfish Hospital and get some additional physical therapy after her surgeries, which were all done at Monument hospitals. Her post-surgery therapies would be through Monument facilities. And now all of the specialists, the neurologists, the physiatrists, they're all through Monument. And the really nice thing, you really develop a relationship with those physicians. You see them outside of the clinic. They know us as people and as a family and not just a patient.
Right.
See them at basketball games and other events.
So who makes these saddles?
A guy by the name of Randy Bird
Where at?
in Texas.
Really?
He was in an auto accident and ended up paralyzed himself.
Okay.
And I think that's how he got into the business.
Wow.
It's got a pretty interesting story. He was drinking and driving when he wrecked, and that's how he got paralyzed, and now he's a minister.
That's a beautiful saddle.
It is, it is. He details that I didn't even request. He knew her favorite color was purple, so put the purple on the stirrups and purple in her name on the back.
Very nice tooling.
Yeah.
And really, looking at it, it's not rocket science.
No, not at all.
But it's still something that takes a little specialty.
Special, yep. Yeah, little things like initially when we got it, the leather strap for her was too wide. So we had to take a lot of measurements to send to him before he built it. What do you think, Morgan? Is he getting his saddle on? So you want, if you'll hold the horse.
I'd be happy.
This is the next thing we need to engineer is a ramp. Yeah. I'll spin. You holding on for dear life, Morgan? Well, we one time helped a friend gather some calves before branding, and she and I rode out in the pasture and helped do that.
So she just doesn't have much control over muscle, or does she?
She muscle control on her left side is better than her right. Her right side is really spastic. She can use that hand as a helper hand, but really doesn't have any function with it. She walks with assistance, like under her the arms.
Yeah, well, I noticed like when you're getting her out, she definitely...
Yeah, that's how, unless we're traveling, going a further distance, then she'll ride in her chair. But for the most part, it's just...
Just fine.
Yeah. No.
Come on.
There you go. Hold on. Yay. Yay. No.
Oh, you're posing now.
Oh, are you?
Posing for the camera.
Are you riding, Morgan? Oh, yeah.
So let's talk just a little bit about rural healthcare. And, you're not that far away, but you're a little ways away. I mean, how, as a parent, that access has got to just mean everything to you.
It does, yeah. With the advent of electronic records during COVID, when visits were so limited, we were able to take advantage of video visits or telephone visits. And when you have that relationship with your providers, they're comfortable.
Right.
If you need a new prescription, you can have a telephone visit or a video visit because you've had that relationship. Their collaboration with Mayo, now patients can actually have an evaluation or a consult with a Mayo provider without ever having to leave the area.
That's awesome.
We have clinics, Buffalo, South Dakota is 75 miles from here, so they're even more remote. So the technology for them, digital x-rays, instead of having to ship a film to the hospital in Spearfish to find out if there's a broken bone, they can find out within minutes.
Right, that's awesome. I mean, you've got a pretty special girl here, and she's very social. What do people need to know about people with some special needs?
Mostly she can do whatever we do, but sometimes we make modifications so that she can be involved and she can participate. And she's very much accepted, very loved. My son has said that she's famous. It doesn't matter where we go. People know Morgan because we've been to basketball games and rodeos.
Well, what a testament to you guys to get her out, because it takes some effort.
It has. It's been a humbling experience. And it definitely does take effort, but she's made us better people.
Dr. Sanders is our doctor at Monument Health. She's the doctor of physical therapy, and she has been a crucial part of this whole journey with Rennie and muscular dystrophy. Not only is she a wonderful doctor and very caring, but she is also a friend.
Yeah, that's cool.
She's come and watched us at the Heart Ranch rodeo and hangs out with the kids and just gives lots of support, and we're very thankful to have her in our lives.
When did you find out that she had muscular dystrophy?
When she was 6 months old, so she'll be 4 in January, so no one knew she had anything wrong with her the first 6 months. I knew something was wrong.
Really?
Yeah, she was really floppy and just not like Brindle was. She couldn't hold her head up and just had some different issues, and it was until she was hospitalized with RSV and got pneumonia. We were flown to Sioux Falls. Monument tried kind of figuring out, they were kind of running some tests and stuff, but we had to go to Sioux Falls because Monument doesn't have a PICU, and so she needed to go to the PICU, and then that's when we finally found out she had muscular dystrophy, and so
that had to be pretty tough to hear. I mean, even if you knew something was wrong, that's...
Yeah, I mean, pretty tough. It was definitely not something we expected, but she's a blessing, and you know, we just keep going with our life and know that God has a plan, and what a great way to raise children.
You can just see she sits up there, like it's different from when she was in the stroller.
Yeah, she just loves it.
I had a horsey.
You got your horsey?
E16.
Did you realize something was not quite the same with Remy early on too, or not as much?
I didn't have the motherly instincts that Amy did, but you know, it was when we took her in, you know, you could tell there was something not right, and so it was good just to actually find the answers,
figure out what really something's going on. Because that's sometimes worse than knowing what's wrong, is knowing there's something wrong and not knowing what it is, right?
Yeah. No, I mean, you just always want the best for your kids, so it's no, it wasn't, you know, anybody's dream that, but it, you know, we're very blessed now that she's doing good.
So she seems
thriving.
Healthy, I mean, generally speaking.
And she's always happy and always in a good mood. So that's I guess that's all you can ask for.
I don't know much about muscular dystrophy. Obviously, that they can't develop muscles and support themselves or whatever. But I mean, how does that affect them long term? I mean, is she still going to be able to be healthy long term without being able to walk, or do you know?
You know, I really don't know, and I guess it's probably anybody's guess, and Amy could probably tell you more about it than, but I guess we just right now we're just take it one day at a time, and
well, that's all any of us can do. Really. So.
Yeah, so Seed, we also do equine therapy with Remy, because the horse's gait mimics people walking. So it's really good for her to ride horses, since she doesn't walk, to get that gait movement.
So it just helps her body kind of develop somewhat?
Yep, so a lot of times we ride bareback, so
she can feel it just a little more.
We'll ride her together and have someone lead us around, and so.
Talk a little bit more about that physical therapy. Where did that come from? Was that your idea? Did people tell you about that, and how has that helped?
All along, when we got her diagnosis of muscular dystrophy, I always said, you know, they said she wouldn't walk, and I always said, well, if she can't walk, a horse will walk for her. So anyways, her one physical therapist who also does swimming therapy. She's from Texas. She was trained to do equine therapy.
Oh, really?
And I believe they call it hypotherapy or hydrotherapy, something like that. So she has come out to the house and trained with me and Remy and has shown us different things. And we actually also have taken our horse into Rapid and had other children with disabilities ride too, because I want to share that experience with another child who
may not be fortunate enough to have a horse that trustworthy right here. So another thing you guys have been involved with is the Children's Miracle Network, is that right?
Yes.
So what's that process been like? What have you learned?
So when we were going back and forth to Sioux Falls for care and finding out her diagnosis, they were very generous in giving us money for travel and for hotel and food and stuff. So I work in the mortgage business, and so I kind of took off quite a bit of time. So
right. If you're not working, you're not getting paid.
Yeah, to have that extra help for travel and living expensive we're very grateful.
You can make it work.
Yeah, very grateful. The support we got from people we didn't even know, and our wonderful community and the ranching community.
Yep.
I mean, it's unbelievable.
Taylor rides just as well as anyone.